Good evening, everyone. Thank you for joining us for this week's Community Leader Telephone TownHall. We're going to get started here in just a moment, but we want to thank you so much for joining us. We know a bunch of our neighbors are joining us here, so we're going to give it a few more minutes for everyone to hop on, and we'll get started. Thank you. Again, we want to thank everybody for joining us for this week's Community Leader Town Hall. We're going to get started here in just a minute, but we want to thank you all for joining us. Again, for the most up-to-date information and resources related to the district's response to coronavirus, you can visit coronavirus.dc.gov, and we're going to get started here in just 1 minute. Good evening, and thank you for joining us for this week's Community Leader Town Hall. My name is Tomas, and I am the Deputy Chief of Staff to Mayor Muriel Bowser, and I want to thank you all for joining us for this week's call. We are going to hear today from Dr. LaQuandra Nesbitt, the Director of the D.C. Department of Health, and then we also have Director Christopher Rodriguez from the D.C. Department of Homeland Security and Emergency Management, who will be joining us to help answer questions during the Q&A portion of the program. If you have any questions, you can press 0 now to get entered into the queue for our Q&A portion of the program. Before we hear from Dr. Nesbitt, I did want to start the call by reminding everyone of an activity that we hope everyone will complete as soon as possible, which is filling out your census. So you can do that quickly by visiting 2020census.gov today, and you can complete your census and help us ensure that everyone in the district is counted. So without further ado, we're going to hear now from Dr. LaQuandra Nesbitt. Dr. Nesbitt?
Hi, Tomas, and thank you so much for being here today to help facilitate this discussion. I want to thank everyone who is taking time out of their day for joining us on the call again this week. To date here in the district, unfortunately, we have had over 10,300 residents in the district who have tested positive for COVID-19, as well as we have had over 550 district residents who have lost their lives due to COVID-19 in the district. I just want to have the opportunity to talk a little bit about the July 4th holiday that is vastly approaching, and I want to provide a few reminders and tips on how to celebrate safely. We want you to consider celebrating at home with those who are in your home or close to home. If you are planning to host others or attend an event at someone else's home, remember outdoor activities are preferred over indoor activities. The virus can still spread outdoors, so remember wearing a face covering and social distancing will be important. If you are not able to safely social distance, you may want to reconsider your attendance if you accept an invitation for a gathering, and your guest list if you are hosting an event at your home. If you are hosting an event, here are a few additional safe practices to keep in mind. The events over 50 are still prohibited in the District of Columbia. If you have a home or a space that can accommodate 50 people, you still want to make sure that social distancing can occur. And while events for up to 50 people are permitted, you still want to be mindful of your space and the amount of space that you have available when choosing to host an event. If at any time you or anyone in your household does not feel well, you should cancel your gathering. You should discourage guests from gathering in groups. You should keep a list of guests in case it's needed for contact tracing. You should ensure guests can practice proper hand hygiene and have soap and water and or hand sanitizer available, and should consider actually developing hand sanitation or sanitation stations at your gathering. Limit the use of shared items and consider providing cleaning supplies for guests to wipe down and sanitize shared surfaces, such as door handles and bathrooms. For more guidance on how to have a safe gathering, you should visit coronavirus.dc.gov/phase 2. Lastly, if you need a test, you can get a test. The district's testing sites will be closed on Friday and Saturday of this week. However, if you need a test, Firehouse is 8, located at 1520 C Street Southeast, 10, located at 1342 Florida Avenue Northeast, Station 30, located at 49th Street Northeast, and Firehouse number 33, located at 101 Atlantic Street Southeast, are open from 4 p.m. to 8 p.m. today and tomorrow. Also, from 10 a.m. to 2 p.m. tomorrow, July 2nd, you can obtain a test at UDC's Bertie Backus campus and Judiciary Square, F Street Northwest, between 4th and 5th Street. For more information about COVID-19 and the district's response, we always want you to visit coronavirus.dc.gov. And remember, if you choose to celebrate with others, we want you to do so safely. It's important to remember to protect yourself and protect others, to wear a mask or face covering, and to keep 6 feet of distance from others, and to choose your activities wisely. So with that, I'll turn it back over to you, Tomas.
Thank you, Dr. Nesbitt. And I want to reiterate, again, the website, for all of our guidances, including how to safely host an activity for 4th of July, but also just our guidances for Phase 2, as Dr. Nesbitt said, are all available at coronavirus.dc.gov/phase 2. And then if you are looking for all testing locations, you can go to needatest.getatest.com. So we will now go into the question and answer portion of the program. I know we are joined by Director Rodriguez as well for any questions that may be part of his purview. So if you have a question, you can press the arrow now to get entered into the queue, and then our screeners will be able to add you into our question queue. We'll go to our first question from Marie Cohen. Marie, your line is unmuted. Marie,
hello.
Yep,
I see. I thought my question was recorded. I'm sorry. I have not done this before. So I'm supposed to ask the question now, right?
Yep, and we appreciate you joining us for your first question.
Oh, great. I'm so excited. All right, this is for Dr. Nesbitt, and I have to apologize. I'm a data geek, and this is a really geeky question, okay? But I've been watching the community spread graph every day, okay? And I'm just fascinated by it. And what I understand that every day when you find new cases, when there are new test results that are positive, you then add that data point into the date when that person became symptomatic. But so that today you might be adding new cases for like a week ago or 2 weeks ago. But I have noticed, and someone else has noticed too, that sometimes what happens is, let's say today, suddenly the number of cases that began on, let's say, June 11th, some earlier day, will actually go down. So how do the points on the community spread actually decrease sometimes with the passage of time?
It's a great question, and if you've had that observation, it is not an observation that you have frequently, and it may be a change of 2 or 3 cases. It is not a huge fluctuation, and it happens very infrequently. What we do is for people who are asymptomatic or people who we have not been able to confirm or have an interview with, then we do an estimated date of infection for them and plot them on the curve. And when we are able to do confirmation through an interview, then their date may be updated.
Thank you, Dr. Nesbitt. We will next go to Tanya Baskins from Ward 5. Tanya, your line is unmuted.
Hello. My question is, when will hospitals be able to start having surgeries? Because I'm waiting right now to have a surgery.
Hi, thank you for your question. That is a decision that is between you and your healthcare provider. Hospitals have always been able to provide surgeries based on the decision between the patient and their healthcare provider. During our peak times of infection, hospitals were instructed to have suspension of non-emergency healthcare services and non-elective healthcare procedures. As we moved into the initial phases of reopening, hospitals were given more latitude or guidance to have more latitude that would allow them to resume some of the non-elective procedures as long as healthcare resources could be made available as it relates to the ability to respond to COVID patients and to have adequate personal protective equipment. However, the decision to provide a patient healthcare services, including surgical procedures, is a decision that is between the treating physician and that patient.
Thank you, Dr. Nesbitt. We'll go to our next question from Ruth from Ward 2. Ruth, your line is unmuted.
Okay. Can you hear me?
Yes, we can. Go ahead.
Okay. I live in DuPont Logan, and I have noticed that a large number of people are walking around without masks. And I'm concerned with what this means as we open up further. So I'm wondering if DC is considering making mask wearing in public mandatory.
Thank you for that question, Ruth. We'll go to Dr. Nesbitt for the response on that.
Thank you so much for your question, Ruth. We always continue to review the guidance and the best practices around mandates versus recommendations. You can review all of our guidance documents, including the guidance toward the public, and the most recent CDC guidance that was published this week regarding the use of masks and face coverings. What we have observed, and we appreciate the feedback that we get from members of the public like yourself regarding particular neighborhoods in terms of mask use. The most recent CDC guidance around this issue ensures that we are focusing on the areas of mask use where social distancing cannot occur, ensuring that people use masks when they are within close proximity to each other, and also making sure that we understand that individuals may not be using masks when they are participating in physical activity where increased exertion may be occurring. And so when we get feedback from people who state that they are noticing that people are outdoors and not using masks, we'd like to know if they are observing this when people may be biking for physical activity and jogging and other things, and may need to be aware that people may be having increased exertion, and the use of masks may cause problems for those individuals. But again, we always look at and continue to review the best practices around mandates versus recommendations.
Thank you, Dr. Nesbitt. We're going to go next to Alice Thomas from Ward 6. Alice, your line is unmuted.
Hello, how you doing? I just wanted to ask, in light of this surge of cases nationally, I was wondering if the area universities are consulting with the city on their plans for reopening their universities. I would think it's very concerning that these universities will attract people from all over the country when the fall comes back, and that may threaten our numbers, which look really good and have looked good for a long time now.
Thank you for that question, Alice. We'll go to Dr. Nesbitt or Dr. Rodriguez for a response on that one.
Hi, thank you for the question. Yes, we have worked with all of the colleges and universities within the District of Columbia to provide them consultation around their plans as to how students will return to campus, how campuses will operate through this upcoming academic year as it relates to their prevention plans, their response plans, et cetera. As you know, the colleges and universities in the District of Columbia are very diverse. Some of them offer on-campus housing, some of them do not. Some of them participate in intercollegiate athletics, and some of them do not. And so we've engaged with them in a number of ways around the types of programs and offerings they will have. Even in the face of the increase in cases that a number of states are experiencing, and even though we know that sometimes this increase is related to particular demographic groups, including those who are younger, we continue to monitor the evidence related to institutions of higher education and what that means for testing that population, what that means for ongoing testing, any mandates regarding testing them to requiring testing for them to return to school, et cetera. All of those things we have provided guidance and consultation to the universities and believe that it is appropriate for them to allow their students to return to campus for the fall under the current conditions.
Thank you, Dr. Nesbitt. We'll go next to Pat Elwood. Pat, your line is unmuted.
Yes, hello. Hi, Tomas and everybody. Dr. Nesbitt, thank you for everything you're doing. My question has to do with the importance of wearing a mask and the irony that if you go in a restaurant, you have to wear a mask, or even at your July 4th gatherings. But in order to eat, you have to take off your mask. And I suppose you might say social distancing when you eat, but that may not happen. And I'm wondering if not wearing a mask while you're eating negates all the safety measures you've taken beforehand.
Thank you for that question. We'll go to Dr. Nesbitt for a response on that.
Well, I'd ask you to think about the circumstances and all of the other measures that have been put into place for our restaurants. If you have not had the chance, we'd ask you to look at the guidance documents that we put out and published for restaurants reopening, both for indoor and outdoor. And we have made recommendations about the size of groups that are dining, the amount of space in between the tables. In phase 1 of reopening, we had limitations on outdoor dining, including the capacity if people had or facilities had outdoor dining spaces, and those capacity limitations still are in place for indoor dining. So while we rely heavily on the use of masks in indoor settings, there are also other mitigation and social distancing measures that can be put in place. As you have outlined, it is not practical to wear a mask while consuming food, and so we have to rely on some of these other mitigation measures for restaurant and food retail establishments where people are in the facility or outdoors and consuming food. So that's why we have things like a restriction of the number of individuals who can be in the party, recommending that the party be restricted to people from the same household, that people not be allowed to queue in the restaurant or outside the restaurant, requiring reservations for individuals. All of those types of things help to be part of our mitigation and social distancing strategies.
Thank you, Dr. Nesbitt, for that. We'll go next to, and we have just a few more minutes for a few more questions. So again, if you haven't been able to press 0, and you have a question, please do so now. We'll go next to Jacqueline Mears. Jacqueline, your line is unmuted.
Yes, indeed. Dr. Nesbitt, this is for you. I'm concerned about gyms who are following your regulations and saying as long as you're exercising or as long as you are working out, you do not have to wear a mask. However, these are enclosed spaces, and to that extent, they follow your directions. And if you do not have a mask when you're in a class, for example, or even while you're training and there are other people in close vicinity, that heavy breathing is part of the activity. So I can understand outside, if you're running, you're doing something like that, you're in the open air. But when you're in these enclosed spaces, can it not be mandated that anybody who comes, they don't need to come, they can go do something somewhere else. But those who come are wearing masks, period.
So thank you for the question. This is another opportunity for me to, again, talk about the social distancing measures that are in the guidance document related to gyms and fitness centers and where we are with phase 2. So, again, the equipment is staggered. People should not be in close proximity to each other in those facilities. But I also want you all to recognize and understand that there could be adverse consequences to someone who is physically exerting themselves with, I want to make sure I'm being very clear here. The use of a mask for someone who is at their baseline level of physical exertion is safe. It does not cause them impaired breathing. If someone is physically exerting themselves in a gymnasium, on a treadmill, lifting weights, doing extreme cardio, it is not appropriate for them to wear certain types of masks. The second piece, and there has been some fitness studies and infectious disease experts has opined on this, and the updated CDC guidance talks about this. It is inappropriate to wear a mask that is soiled or wet. So when you talk about people in gymnasiums being required, in fitness studios and gyms being required to wear a mask where they perspire, and now the mask is soiled and wet, that could actually increase the risk of transmission, okay, and cause problems with breathing. So we are not going to make that recommendation to mandate that people do something that may adversely impact their health.
Thank you, Dr. Nesbitt. And again, a good time to remind everyone, all of our guidances are available at coronavirus.dc.gov/phase2. So if there's questions that you heard today and you're like, oh, I haven't seen that guidance, please go to the website and you can read through all of the guidances so that you can see how the different recommendations from our public health experts. So let's go next to Kathy Donahue from Ward 3. Kathy, your line is unmuted.
Hi, thank you for taking my call. I was wondering if there is any thing going to be put in place for some of the misinformation that has been put out to the public about contact tracing. I've seen things online that say, hey, the government's going to come get you and take you away if they find out you have COVID. I was watching on national TV the other day, Jimmy Swaggart or his family was on TV saying that they could take your kids away. Is there anything that we're working on to combat this misinformation that's being put out there to the public?
Yes, thank you for the question. There's a couple of things that we are doing that are more grassroots level campaigns and providing financial resources to grassroots organizations. to help people understand exactly what happens with the process of contact tracing and to help them understand what their rights are from a privacy perspective and what the government is interested in and what the government will and will not do. And it addresses those very specific things that you're talking about. We will be making sure that those community organizations who have very great credibility and are credible messengers with specific communities and unique community-based organizations have been chosen to do the outreach to our African immigrant communities and our Latinx immigrant communities, as well as our communities, our deaf or hearing impaired communities. In particular, our communities of focus for us. That's a very specific effort and initiative that we've done. Separate from that, there was a funding announcement and decisions will be made very soon related to that, where community-based organizations that provide health and human services related activities, recreational programs, and other social services that have close relationships with people who may be most likely to be diagnosed with COVID-19 can receive funding from the district. Their grants, I believe, it's a range of maybe $25,000 to $50,000, but part of that requires them to know, like, contact tracing 101. So they have the skill set that they need for any client, and these are not people, their clients are not people that are diagnosed with COVID-19, but they understand and are able to communicate to the community broadly exactly what contact tracing is. So it helps us to bust those myths beyond the type of things that we typically do with large-scale media campaigns that help people understand what contact tracing is. So we're coming at this from a number of ways, but it is critically important, as you said, that we can disrupt myths about people being deported or it being a tactic that the government is using to get access to information for inappropriate activities. That's not what we're doing here. Contact tracing is part of what we call our box-it-in strategy for COVID-19, where we test individuals, we isolate them, we figure out their contacts, and we quarantine their contacts, all as a way to disrupt transmission of the virus. And it really does help us identify individuals who don't have the resources to isolate, and we can provide them the ability to do so if they need housing support from us, if they need food access while they're isolating, and any other health and human services or social support services that the government can provide to help them and their family members be successful.
Thank you, Dr. Nesbitt. And we will go to our last question of this week's call. Diane from Ward 6, your line is unmuted. Diane, Ward 6, your line is unmuted.
Hi, this is Diane from Ward 6, and my question concerns social distancing, particularly the plans to support social distancing while also during this warm weather season offer cooling centers. As you know, in the past, cooling centers have been used particularly for some seniors and other populations who may be particularly susceptible to some sort of health distress because they don't have sufficient coolant in their homes.
Thank you for that question, Diane. I believe Director Rodriguez is still with us. Director, are you on the line still? I think we lost Director Rodriguez there, but that is a great question, and we appreciate you asking that question because we are in the season of heat emergencies. And so HCEMA is working with all of our agency partners on the activation related to the heat emergency plan, where we will have cooling centers and be practicing social distancing and other measures related to that at the cooling centers. And so you can actually visit heat.dc.gov to get full information about the heat emergency plan, as well as a new interactive map for the cooling centers that have been brought online for this summer, and then more information about safety at the cooling centers due to COVID-19. So that's all available, again, at heat.dc.gov, and our Homeland Security and Emergency Management Department have been working on that to make sure that we can provide the cooling centers to residents while respecting safe social distancing as well. So that is it for the questions for this week, but we want to thank you all for joining us. Again, I want to remind everyone that for all of the most up-to-date information for our response and recovery efforts related to COVID-19, you can visit coronavirus.dc.gov. I also threw out the link for anything related to the heat emergency plan. Just to say that again, that is heat.dc.gov. You can visit those two sites for information for COVID and then also information for heat. As we know, it's the temperature is going up. It's going to be a hot July, so make sure that you familiarize yourself with the emergency plan as well. And then I want to remind everyone again before we get off this call, if you've not done so already, 2020census.gov, make sure you go and complete your census. You'll be hearing a lot from us in the coming days, reminding people to complete their census so we can make sure that every Washingtonian is counted. So we thank you so much for being here. I want to thank Dr. Nesbitt and Dr. Rodriguez for being on the call with us. We'll be here again next week at 5 p.m. next Wednesday. So thank you all so much, and we hope that you will visit coronavirus.dc.gov for more information. Thank you.